Hi, my name is Greg Evans. I'm a practicing pediatric dentist in Fort Collins, Colorado. The question you asked is a good one and one I answer frequently. Surprisingly, a lot of dental professionals do not know how to treat infant teething pain, and there's a lot of false information out there. Here are the facts. Teething pain can range from mild to excruciating, where the kids are up all night crying and drooling, and it does not depend on a child's age or gender or overall health. Teething pain usually is the worst when the first primary molars are being cut in about 13 to 19 months. Closely behind that is the canines that come in after those premolars, but in front of them at about 22 months. And surprisingly, the largest baby teeth in the mouth, the second primary molars that come from 30 to 36 months, are really not bad at all compared to the other teeth. In my experience, teething pain is cyclical, meaning that it comes and goes over time. It gets worse and then it gets better. And as such, there are several good remedies that you can use. The first method is rubbing a finger firmly over the gum pad of the erupting tooth on a child. Don't forget to wash your hands. But it seems that the pressure or the ability to push the blood away from that area temporarily numbs and may give a child some relief. The same relief may be found with the child chewing on a toy or some other soft object for periods of time. A second method may be to get some over-the-counter topical anesthetics such as Ambicel or Oragel. If you place a small amount on a tissue or a Q-tip and rub that over the affected area, that will soothe the pain for about 10 to 15 minutes, enough for a child to get through a meal or get off to bed. Be careful not to use too much topical anesthetic in a child's mouth because it'll float around and then the child will have a very poor reaction if that anesthetic numbs the back of the throat and they have a hard time swallowing. For longer episodes of teething pain, I recommend good old Tylenol. Because the pain is cyclical, it comes and goes, Tylenol that you give that lasts for about 4 hours at a time is a very good remedy that will get a kid through the night or off to bed. You can also use Advil. The normal dose for Tylenol is 15 milligrams per kilogram. For the average 20 to 25 pound child who's 1 year old, it's almost exactly a teaspoon of the children's Tylenol that's 160 milligrams per 5 mLs. It was made for this. That's a very good remedy to do, and you can use that in addition to rubbing the gums or using the topical anesthetic. Overall, teething pain is something that children are going to get through and they're going to be okay. Be aware that kids are also allowed, just like to adults, to have more than one problem at a time. Since a child is teething from about 7 months all the way up until about 36 months, they can also get other illnesses. High fever, lymphadenopathy or swollen lips, runny nose, sores on the tongue or the lips may very well mean that they have another illness. The combination of a very sore mouth, difficulty swallowing, swollen nodes and a high fever may mean that they're having a primary herpes infection. And a good pediatric dentist would be well versed in these childhood diseases and can treat those as well as figuring out what is and what isn't teething. There are several old wives' tales surrounding teething. One is that children get fevers while teething. Well, it may be true that if a child drools quite a bit while they're teething and dehydrates themselves, they may have a slight elevation of temperature. But anything over 101 or 102, like I said, is something else. The second wives' tale is diarrhea. You can imagine that if a child drools a lot and swallows, which I've never seen a kid do that, they may have a runny stool. But diarrhea is not a form of teething, and it may be a form of another illness. For more details on this question or for answers to other questions you might have, please go to my website at www.biggrinswithdrgreg.com or just email me. I love what I do and I would love to help you raise healthy, happy children. Thanks for tuning in.